Hi everyone, Dr. Maciejewski with Executive Park Eye Care. What do you do when your vision starts to get blurry? Well, typically you give us a call, you come in and you sit in this big chair, we put this crazy device in front of your face and we start flipping lenses asking you which one's better, 1 or 2. And in a couple of minutes, we find a glasses prescription that helps you to see the world a lot more clearly. We send you to the optical and then you're off on your way. So what's actually going on when we're looking at this and why do you need glasses? Let's take a look. So we're going to look at a couple different refractive errors or prescriptions. When you are nearsighted or have myopia, the image you see is focused inside of the eye, causing the image on the retina to be blurry. We prescribe you a lens that moves the image back to the retina in order to make it clear again. People who are farsighted or have hyperopia, the image is actually focused behind the eye, again causing the image at the retina to be blurry. So we use a different curve for the lens, causing the image to then be clear on the retina. And some people have what we call astigmatism. That's where the shape of the eye is a little bit different, like a football, and so there's 2 different curves. This causes the image to focus at 2 different spots of the eye, and it can both be in front or behind the retina or kind of splitting the retina like this image. What happens with this is you'll get some blurriness around the borders, glare and halos or starburst around lights, and maybe some distortion for your vision. The glasses and contact lenses then counteract the curve of your eye in order to give you that sharper focus on the retina here. Now, presbyopia is a little bit different. This is when our focusing system gets a little bit weaker as we get older, and it doesn't want to focus the image to the retina anymore. So normally, when we look at something up close, our eye accommodates and focuses, moves the muscles inside of the eye, and we get a clear image on the retina. But again, with presbyopia, those muscles don't work as well, so the image is focused behind the eye like it is with a hyperope or farsighted person. Again, we give you a different corrective lens that has different powers for both your distance and your reading, and that pulls the image again towards the retina in order to give us that clearer focus. So, as you saw in those images, it's your anatomy and the shape of your eye that affects and determines what we prescribe for you. Now, there are different options of what we can prescribe. Glasses and contact lenses are the typical options, but there's also refractive eye surgery, PRK, LASIK, and implanted lenses. Now, with surgery, we would have to do several additional tests in order to determine if you really are a candidate and send those results off to a surgeon. Now, surgery would only be able to correct for your distance vision, so some people would still require reading glasses for up close. And because it is a surgery, there's always the risk of complications where you're not going to get that perfect result, and so you might be in glasses full time even though you've had the surgery. Glasses, we're able to do pretty much anything. So we can correct for your distance vision with the astigmatism and put in that multifocal capacity in the lens. So with the multifocal lens, we can do the line bifocal, or what's known as the progressive, the no line bifocal. With the progressive lens, it's a gradual transition through the lens to correct for your distance, your computer, and your reading. Now, you might hear that some people who have done those lenses have to tilt their head all the way up in order to get that clear focus for their computer monitors. There are several updated lenses out there, so you shouldn't have to do that anymore. It's just picking the right lens for you. There's also the line bifocal. We do still use those occasionally. There are lines on the lens which differentiate where your distance, your computer, or your reading is. So that is still an available option for us today. Now, with contact lenses, it can become a little bit more challenging. Just correcting for your distance vision with or without the astigmatism is easy. But if you want to add in that component for your reading and your up close, that becomes a little more challenging, and we might have to try a couple different options. So there are multifocal contact lenses, and just recently they came out with multifocal astigmatism contact lenses. So we used to have to just correct one eye for far away and change the prescription to correct for the up close in the other eye. But now with the multifocal lenses, most people are able to get clear, comfortable vision at every range. Now, you might not have the clear vision that you're used to having with your glasses. There might be a little bit of a compromise where there's some fuzziness, but as long as we can get you to where you're able to function and do what you need to do throughout the day, then that's what our goal is. So if you're noticing that your vision is changing and it's been a while since you've had your eye exam, give us a call and we'll get you in to check things out. And we'll figure out what the best option is for you for your corrective needs. Hope you all have a great day. Bye.